Well, hello, I'm Jason Renaud. I'm the conference coordinator and speaking with Richard Cho after his keynote talk. And we're recording this a few days before the conference because of the potential federal shutdown, and just to ensure that Richard can be with us and answer some questions. So I'm going to ask some questions that I think the audience members would have. And first, I thank you for your talk. That's inspirational and wonderful accomplishments of the Biden administration and the list of things that are to come. It's quite amazing.
Well, we see addressing homelessness as one of our top priorities, Jason. So, it's the least we can do, as Secretary Fudge says. If there's something that we are not doing that we could be doing, to let us know, because we are looking to try to do everything we can to help communities address this crisis.
Well, could you tell us a little bit more about yourself? This is a strange preoccupation, homelessness. There's all sorts of wonderful things to do in public administration. Why did you pick this as a problem to solve?
That's a great question, Jason. I think very early on understood that that there are people who live in our nation and our world who unfortunately don't have the ability to have the stability of a home. My own family experience certainly have had instances where housing insecurity has been something that my family experienced. I had a grandmother who actually lived in HUD assisted senior housing in the city of Chicago. So I understand that on the one hand, we see people every day who lack a home. And on the other hand, we know that there's actually ways that we can make inclusive communities that enable people to have homes. And so I think those two kind of contradictions exist in my head, and that's something I've never been able to let go. I would say been working to address homelessness for now over 20 years. And it's not something I've wanted to do. I certainly don't think it should take this long for us to be able to solve homelessness. But I committed to continue to work towards a day when we will not see homelessness in America.
That's wonderful to hear that you hold your family in your heart as you do this work. So out here in Oregon, we really do think we have it rough. We think the gossip is always how dysfunctional our service system is and how challenging the future looks. Could you have the national perspective? How are we doing? Can you speak a little bit about Oregon in particular?
Well, I think the first thing I want to say, and which I addressed in my remarks a bit, is we should not let ourselves get down because we're seeing homelessness persist or even grow. I mean, there's always more and better things that we could all be doing collectively at the federal level and at the local level to address homelessness. But homelessness is not the fault of the homeless service system, certainly. It is certainly not the fault of the approaches that we're taking and the work that we're doing. The work that people do to solve homelessness and connect people to housing is valuable. That is some of the best work that we're seeing in the nation. We should remember that the starting point for all this is that we have a severe shortage of housing in this nation. What is driving homelessness is that severe housing shortage. It's like a cruel game of musical chairs where there are not enough chairs and more people actually trying to compete for those chairs. And by the way, the people who have the least chance to actually get a chair when the music stops are people who have disabilities, people who have chronic health conditions, including addiction and mental illness, and also seniors. We're seeing a growing cohort of older adults who are experiencing homelessness for the first time. And so let's all remember that the starting point is that many of us who began this work, we inherited a problem that is driven by our housing shortage and many years of not actually building enough housing that it meets the demand. Not to mention building housing that tends to cater to the higher end of the rental market and not meeting affordable housing needs. And so there's a long history behind that, and policy choices that were made, choices that we are in the Biden administration are trying to undo by reviving a focus on investing in affordable housing and providing rental assistance to people. But again, I don't want people who work in solving homelessness to get down because they're seeing a growing problem. Hundreds and thousands of people are getting housed every year. Homelessness is being solved for people at a household level all the time. But again, for every person that we house, there seems to be 10 more people who actually become homeless for the first time. And so it feels sometimes like the problem's never ending. We need policy change. We need significant investment in affordable housing. but we also need to continue to support people who are committed to helping connect people who are already homeless to housing and support services.
It's good to hear. That's very reassuring. We talk a lot in this conference about the Martin versus Boise opinion by the Department of Justice, and there's a lot of work being done out here to try to help those cities to deal with Martin. Is there any sort of solution proffered that's specific to Martin and people who are homeless and unsheltered that you can speak about?
Yeah, I mean, I think the first thing I'll say is that I feel like we've sometimes been led down a path to think that there's only two choices in addressing unsheltered homelessness. On the one hand, we think, many of us feel like maybe we'll never solve unsheltered homelessness. And so the best thing to do is just to continue to displace people and clear people's encampments and try to disappear the problem or somehow discourage people from sleeping outside as if like there's alternatives. And then an alternative where people have also given up on the idea that we can solve this problem through housing. And so the answer is let's leave them alone or even sanction encampments and leave them alone. I think there's actually the third choice. And the third choice is the right choice, which is we can actually house people. We can solve encampments by connecting people to housing and supportive services. Now, Martin v. Boise and some of these important cases that are, have been decided in the courts and are continuing to be reviewed by courts. What it essentially does is say people should not be cruelly punished and arrested and detained or jailed because of their lack of having a place to sleep at night. It doesn't say anything about the fact that communities do have real challenges and they do need to find ways to ensure that, homeless encampments are addressed. But I think what's missing in that conversation is that we can actually solve homelessness by connecting people to housing. Now, HUD has actually awarded, as I mentioned, significant grants and vouchers that are intended to help communities to solve unsheltered homelessness by connecting people to housing and supportive services. And the intent there to say, let's create dedicated housing units and vouchers and resources that can reach people who are in encampments. And let's actually work to directly connect people in encampments to housing. And I know there's a small but growing number of communities that have been able to figure out how to rapidly prioritize housing connections for people in encampments so that encampments can actually be closed. But I'll just say, encampments are a symptom of a larger homelessness crisis that's driven by a continued displacement of people every year and by the fact that there are more people become homeless than we can actually rehouse. And so our whole homeless service system is just kind of spilling over the edges. We need to keep our focus on what actually works, and that is to connect people to housing and services quickly, provide them with that stability. And if we could do that so that more people achieve stable homes than actually become homeless, while we're also working to prevent people from becoming homeless in the first place, that's how we'll start to see encampments reduce. And I think sometimes we're so focused on how do we address the problem at hand and a growing public that is pushing for sort of immediate solutions that actually don't get to solving the problem, right? Displacing an encampment doesn't solve it. It just relocates it. People just move to a different location. We need to actually focus on what works.
Yeah, short-term solutions for long-term problems.
Right. I don't know many chronic problems that you solve that way, right? Like the climate crisis, we can't solve that through short-term fixes. We need a multi-pronged approach to solving that. And just like homelessness, we need a multi-pronged approach that calls for investments in affordable housing, a stronger safety net, right? We've seen, and actually we published an article that showed that the pandemic era protections, eviction moratoria, emergency rental assistance, the enhanced child tax credit that put more dollars in families' accounts every month, those collectively help to actually reduce homelessness, even at a time when we've seen growing housing needs. First-time homelessness decreased, and we saw fewer people using homeless shelters during 2021. But of course, all those protections have now expired or wound down. And now we're seeing that the housing needs that we're seeing are translating to more people becoming homeless. We know it works to actually prevent homelessness as well. We just need to continue to focus on those solutions.
Yeah, it's a difficult asterisk 2020 that we added all this money and information and muscle into the continuum. And now as that is ended, how things come back into focus. It's very confusing to operators and of course to people who are in the midst of the system.
Well, and that's where I think we all need to collectively talk about the impact that we think those measures had on reducing the incidence of homelessness, and make that clear to policymakers that if we think there were things that worked during a pandemic, why don't those things exist in regular times?
Yeah, what do you think? Was there anything that came out of that we learned that was new that we didn't know beforehand?
You know, spent decades at HUD working to build continuums of care and really collaborative approaches to addressing homelessness. And, certainly more work to be done, but a lot of good work has been done in building systems, coordinated entry systems, and data systems. When the Emergency Rental Assistance Program, $46 billion that was provided through the American Rescue Plan, as well as other legislative resources to fund emergency rental assistance, we quickly found that there is not a similar kind of organizational infrastructure for eviction prevention, for homelessness prevention, right? We have a homelessness resolution system through the continuums of care. We don't actually have any kind of homelessness prevention system. So communities had to scramble to create a whole new sort of network of and set of kind of infrastructure locally to be able to deploy $46 billion in rental assistance to help people stay in their homes and pay back rent. And I think what we've learned is that we need to figure out how to continue that and grow those systems of response to be the first line of defense against homelessness, and not only have a system that is intended to sort of bail people out of homelessness once they've already become homeless. And so that's one lesson we've learned. The other thing I'll say is that the enhanced child tax credit was probably one of the best social policy measures that has happened maybe since Great Society, and was an amazing experiment that actually helped cut family poverty in half. There's been now a number of studies and some articles written by the Center for Budget and Policy Priorities that showed that the enhanced child tax credit was game-changing for families in poverty. And yet we let it expire. And that is, again, a choice that Congress can make. I hope they make a different choice, and that we certainly believe that the enhanced child tax credit that the American Rescue Plan included is something that should be continued.
It's so much attention was paid to getting money during COVID to communities that were not the typical recipients of largesse, especially communities of color, and in our context, communities of recovery. How do you think HUD did, and how do you think we in general did at getting money to the people who could really make best use of it?
I mean, I think we did pretty well. I mean, in a time of a lot of challenges too, at a time when social services offices and local government agencies many of them were working virtually. We deployed historic levels of resources to communities. I mean, it was maybe a sort of perfect storm of challenged operations at the local level and kind of too many federal resources and programs. That said, I mean, I think I've heard so many stories of communities doing amazing things with that work. We provided $4 billion in emergency solutions grants, a special allocation of coronavirus ESG funds, and communities did amazing work to. I think they, last I heard, rehoused over 80,000 households using those ESG-CP funds, providing rapid rehousing with some additional flexibilities. We also provided a lot of waiver authorities that enabled communities to do innovative things. For example, we made sure that people's documentation of things like their disability status, or verification of their date of birth or social security number, that when those things should not become a barrier, like having documents should not be a barrier to housing. So we also gave waivers to communities so that they could house a person while having additional time to get all their paperwork in place. And that actually proved to be highly successful. And so now we're thinking about to what extent can we issue that same flexibility to communities on an ongoing basis.
That's great to have that reflection and insight that it seems like a whole generation of workforce started too. And it's a lot of young people, and a lot of people with different energy coming in and saying, how can I help? It was a very exciting time and terrifying at the same time.
It is. And we've seen a whole sea change. A lot of people, a lot of staff turnover at the local level, from homeless services staff to people who work in public housing agencies and across human services. And staffing challenges continues to be one of our biggest issues. I'll say HUD, through the appropriations package that kind of hangs in the balance right now, one of the measures that we informed that at least the Senate included in their appropriations markup for HUD was our ability to actually just provide an automatic cost of living adjustment for any homeless services staff that are funded through continuum of care programs. So normally, where COCs have to compete for every dollar through a renewal of a grant, we asked and worked with Congress to say, could we have just the authority that if we have additional funds, we could take a portion of that and just provide an automatic salary bump and salaries and fringe bump to people who work in homelessness frontline staff. And again, the Senate, I think there's been at least I've heard bipartisan support for that measure. I hope that will remain in whatever packages get adopted over the coming weeks.
It is a new, fresh world. Let me ask you about we have urban homelessness in this city of Portland, but Portland is not Oregon. And speak for a moment about the special challenges of administrating homeless services in rural and frontier counties. It just seems to be night and day.
Yeah, it is night and day. And I think there's a lot of both challenges and opportunities. I mean, I know many rural communities where collaboration is actually just easier. Collaboration is actually sort of the name of the game. I hear a lot from rural communities who say, we all go to the same grocery store. We all know each other, or we know that we have to work together because we all don't have enough capacity and resources. And so in many ways, some of the issues that happen in urban areas where sometimes, inadvertently people work in silos or maybe have a sort of competitive dynamic or turf battles, some of that is relaxed. On the other hand, in rural areas, there's just not enough housing. There's not enough rental housing. Using rental assistance to try to connect people to existing housing in rural areas is just exceedingly difficult because there's just not enough rental units available. We also know that sometimes homelessness looks slightly different. People aren't necessarily in homeless shelters. They may or may not be living outside. Many people actually bounce around from different settings or maybe living in doubled up or couch surfing situations. So I think identifying people who are experiencing homelessness in rural areas can be more challenging. But again, I think what I've seen is the resiliency of rural communities and a kind of can-do attitude that I think many cities could probably learn from. It's just this sense of we have to solve this problem because there's nobody else who's going to do so. And that I think has often really worked in favor of a lot of rural communities.
One of the things you mentioned in your talk that we're really excited about here in Oregon is the new Medicaid waiver, the 1115. Can you speak a little bit more in depth about how that would work for a state like Oregon and break it down for us? We're not the nerds down in Salem. We need to help us understand this a little bit better. How is it going to help homelessness and how is it going to help addiction?
Yeah, Jason, let me try. So I think as everybody knows, Medicaid is primarily a health insurance program. It is our nation's health insurance program for people who are poor or disabled and families with children and older adults. And in states like Oregon that have expanded their Medicaid programs now, low-income single individuals who don't have children are eligible. So, it's first and foremost, it's a health insurance program. But one of the kind of things that Medicaid has always funded, and that maybe is less well known, is that Medicaid can fund a set of kind of services that are really intended to help people obtain and maintain their homes. It can fund case management, but it also can fund sort of services that help people find a home and stay in their homes. And states have been able to do that to some degree for certain populations. Certainly for people who are leaving institutional settings, there's what's known as Medicaid home and community-based services, and a state can apply for waivers from the federal government to be able to provide those wraparound home-based supports for people with disabilities who are, say, transitioning from a state psychiatric hospital or other state-funded institutions. But a growing number of states have, and by the way, states can also amend their state Medicaid plan. So the other thing I was going to say is Medicaid is also a health insurance program that's joint federal and state. And so the way Medicaid was set up in the 60s was that states actually developed their Medicaid programs. They are regulated by the federal government to cover a certain set of essential benefits. So certain, going to doctor's visits, hospitalizations, the typical things we think of that are covered by health insurance. But every state also has the ability to try new things under their Medicaid program so they can cover these additional services. And so one of the ways they can do that is through what is known as the 1115 demonstration waivers. And so this is the most sort of a way that states can do things that are slightly outside the box. So what a state can do is apply to the federal government, to the Center for Medicare and Medicaid Services, and say, we'd like to fund services that are not otherwise covered through our state Medicaid plan. And we'd like to try that. And what the federal government can do is approve a state's ability to cover these services over a 5-year period and demonstrate that these services will not only improve people's health, but not necessarily increase people costs, healthcare costs. Because I think the idea is, can we achieve cost neutrality while also trying new things to cover care, particularly for people with complex needs, such as addiction issues. And so what we've seen is a growing number of states asking federal permission to cover services like wraparound case management in housing settings, services that can do homeless outreach and connect people to housing, move-in costs, so furnishings, housing application fees, security deposits, and now a growing number of states are saying, can we cover at least a portion of rental assistance or utility assistance while people are on a waiting list for a voucher? And so we can first cover a bit of rental assistance and bridge them to, say, a housing choice voucher or other types of longer term rental assistance. And around the last few years, we've seen roughly a dozen states or so seeking approval from the federal government to do that. And so my colleagues over at the Center for Medicare and Medicaid Services, instead of looking at each of these state requests in a separate way, actually said, let's look at these as a package and actually develop a kind of framework. And so CMS has worked closely with HUD and myself to say, let's really frame what are the set of housing related services that we think are appropriate to cover under Medicaid, and how does that work with HUD programs? And so what Oregon has done through their 1115 waiver is they've received federal permission to cover tenancy supports, pre-tenancy supports, as well as some of those transitional supports, including short-term rental and utility assistance under their Medicaid programs. And now they've gotten approval to do that. Now, they're still in the early stages. States are still, have a lot to do to figure out how they're going to design these benefits, what rates they're going to set. But pretty soon, what I think the state of Oregon and other states can do is to now create new Medicaid coverable benefits that will cover these services. And many homelessness providers, some of whom may already be billing Medicaid for certain services, or who might be able to partner with, say, a community health center or another agency that already knows how to bill Medicaid, can partner to figure out how they can become the eligible service providers that can draw down and receive Medicaid payment for the kind of services that they provide. So it's a really exciting time. Again, it's in the early stages. And so what I mentioned in my remarks is that HUD and HHS have joined forces to say, we want to be able to help states like Oregon and others who've received that federal permission for these 1115 waivers to cover these additional services under the Medicaid programs to accelerate the pace of implementation. We don't want 5 years to pass and still they're doing work to set rates and design these benefits. We need to move much more quickly because we know there are people right now who could benefit from that combination of wraparound services and housing. And so, Jason, you mentioned, how does this help people who have addiction issues? Some of those are the very folks who need that combination of supports to help them, get case managed to find housing, apply for a voucher, say, or a permanent supportive housing unit, and then to receive ongoing tenancy supports to support their recovery as they move into housing. And I think Medicaid will soon become a source of funds to do that. I'll say states like Massachusetts have really been early leaders in this. And so what we also hope to do is to be able to create a peer-to-peer network of states so that Oregon and Massachusetts and Arizona and California and Hawaii and Washington State can all learn from one another about what it takes to design these benefits and really make them work.
That's kind of amazing. That really makes the promise of permanent supportive housing substantially real, because that support to get in to the housing has been a missing piece for such a long time, and that's terrific.
Absolutely. We funded through our continuum of care program, hundreds of thousands of permanent supportive housing projects or units within many thousands of projects. And it's often communities have to try to use HUD funds for that, which we do. And about $240 million in continuum of care funds a year goes to pay for those supportive services and permanent supportive housing projects, but we know it's not enough. And so it's not often truly supportive housing, it's sort of supportive housing light. And so now having Medicaid really, I think, as you said, fulfills that promise to make housing truly supportive.
So is that benefit already available in Massachusetts?
Yeah, Massachusetts actually has been a leader in this. They've done it over the years now. So they started as a pilot. And then as they've learned about how effective this is, they've continued to scale it up, covering additional people. And in their latest renewal of their 1115 waivers, so they had their initial 5-year period, and then they got a renewal for another 5-year period. They've expanded it even further. And they're also now doing things like going upstream and actually reaching people who are not yet homeless to do some homelessness prevention. But again, what they've done is to scale this supportive services kind of community support benefit for people who are experiencing homelessness really statewide, reaching people who are enrolled in managed care and who are not enrolled in managed care. And so basically any homeless services organization can now identify a person who they think qualifies for this. And as long as the state determines that they meet the medical appropriateness criteria, they can actually draw down funds to cover these wraparound services.
That's very encouraging. More inspiration, more hope in the pipeline. Hope Oregon can get it together and move quickly on that. Let me wrap up by asking kind of maybe a difficult, more philosophical question, in that we have come to a time here on the West Coast where, and maybe this is in part Martin or the lack of local response to Martin, but we have a lot of people who are now shifting their attitude about homelessness from pity and compassion to impatience and fear. There's a lot of fear now that wasn't there a few years ago, and anger. And I wonder if you have any words of wisdom for us about counterbalancing that and helping to shift back to being compassionate, being considerate.
Yeah, I mean, I think we are seeing that unfortunate trend happening not only in Oregon but all over the country. And I think it's a lot of things. I think the pandemic has been really hard on all of us, and I think we've all are seeing at the same time growing mental health challenges, but also I think a general sense that I think the pandemic made people feel vulnerable, and they made people feel like our systems aren't working for us, right? Whether that's the market or government. And I think part of that trickles into homelessness as well, where people feel like something's just not working because they're seeing such a huge volume of people who are sleeping on the streets, who are suffering from behavioral health challenges. And I think it's that vulnerability that they're reacting to when they feel that fear and that anger and that negativity. Now, it's unfortunate. We have to remember these are our neighbors, these are our family members, these are human beings. That's the first and foremost the starting point. And I think how do we shift it back towards that recognition is partly to meet people where they're at. I mean the general public, and to understand, yes, we are also impatient about the pace at which we're not able to reduce homelessness and solve this problem. We're also frustrated that homelessness exists, but it's not to blame the people who are suffering that we should blame. We should recognize what is driving this. And if we can get to establishing that common ground that, yes, we are also frustrated, but that, what we need to do is join forces to understand what is driving this. And that is a rental market that is not meeting the demand, that we have a severe shortage of affordable housing. And I know many communities have been able to establish that shift and rally the public to understand that this is a housing crisis and that everyone's paying too much for housing these days. And home ownership rates. Think about one of the reasons why rental housing costs are driving upwards is because we now have more new household formation. In other words, it's a technical term for there are more people actually forming new households and seeking their own rental units. And a lot of that is because we have a new generation of millennials who've actually been living with their families for a long time and now are entering the rental market. And by the way, they as a generation have had more challenges at buying homes, whereas prior generations, the baby boomers, and I'm a Gen Xer, so we all had a slightly better chances of buying a home, but millennials have been shut out of a really expensive housing purchase market, so they're all in the rental market, and so we have too many people playing the musical chairs game, And if we can help bridge with the general public to understand the same challenges you're facing with paying your mortgage or finding a new home or paying too much in rent is what is driving homelessness, and we can all get around the same solution. I think that's at least one part of the solution. But some of it is also, it's really easy to demonize a faceless person that we just sort of see on the streets. The extent to which we can actually engage with people with lived experience and hear their stories directly. And so I think so much of the work that HUD has done in the last couple of years is to try to put people with lived experience in the driver's seat and let them speak. Because when policy wonks like myself speak, it's not convincing. But when you hear of a person who's experiencing homelessness or who recently exited homelessness and is now housed, when you hear from them about what it takes to actually solve homelessness, that actually changes hearts and minds and also makes our policies and programs better.
Fantastic, Richard. Thank you so much for doing this. Thank you so much for talking with us and being part of the Oregon Housing Conference.
It's my pleasure and my honor, Jason. Thank you so much for having me.